Continues his special investigation into mental health and already being tipped for an Oscar. Don't miss our interview with Mad Max star Charlize Theron. See you in a minute. Hi, welcome back. Still to come this morning, Martin Clunes discusses his beastly encounters a wee bit later on. Right now, though, it's Mental Health Awareness Week, and on Tuesday's show, do you remember, I was joined by former Coronation Street star Adam Rickitt, who discussed his own battle with mental health issues. And today, Adam is continuing his investigation and meeting the families of those affected.
Mental health is as important as physical health.
Mental health is a spectrum.
Everybody knows somebody with a mental health problem.
Today we're talking about the 4 S's: signs, symptoms, support and stopping it. All these people have been touched by mental health, so know all about it.
He was quiet at home, snappy when he did say anything, and generally couldn't be bothered.
We're more like anxiety than depression, but you can identify that manicness in people.
I didn't see any signs to begin with, but I relied mainly, I think, on Nicky's friends. They kind of told me, because Nicky was good at covering up things that were going on.
I knew from the very first time I was sick I had a problem.
For a long, long time I used food, and that food was my drug, and I would eat if I was down, which was a lot of the time for different reasons, and I ended up getting to 26 stone.
I was ill for a long time and I was just in and out of hospital, and I had loads of therapy every week, but I just felt empty all the time.
It's difficult because obviously as a parent, you don't know exactly what's going on.
This deep and terrible fluttery feeling in your stomach when you can't actually leave the room, maybe the bed, maybe the house, or just walk up the road, and somebody will speak to you. They can look straight through your eyes into a hollow body that doesn't really exist inside.
It's only now when I look back that I think, if I was depressed, I'd eat. Yeah. If I was happy, I'd eat.
It stops you thinking.
It stops me thinking.
When I did ask for help, I spoke to whoever I thought was going to be least disappointed in me in a way. So I was worried that my dad would be disappointed, and I just didn't really feel like I was meant to tell him, because I thought it was something you kept private.
If I know you're going through a bad spell, or when I know you're having an issue or something happening, I don't like it. That makes me feel anxious. Yeah. That actually does make me feel anxious, but then it's worried because I know how you're feeling, so I don't like it, but I'd rather feel like that and be able to help than not.
It was difficult to discuss it with Jen. I don't think you understood it.
Not really, no.
Nor did I.
No.
Having support around me, being on medication.
I used exercise. I tried to help others.
They just gave me some labels and some pills and then said, right, this will help you, but it never really did until I got specific help.
I think it's something you're probably going to be battling the rest of your life, to various degrees.
Recovery takes a long time, and I think it's just a lifelong journey.
I don't see it as a battle. I just see it as an aspect of myself.
Well, Adam joins me now along with Dr. Sarah Jarvis. Thank you so much for coming in, Adam. And you really got people to open up there. They were very, very honest, which I think is really important. And for you, were there any sort of early signs for you looking back that you thought maybe that was an indication?
Yeah, there was obviously the physical sides of having an eating disorder. But sure. I think the thing which I realised before anything else was the change in my personality. Yeah. I went from being a very outgoing, sociable young boy to suddenly having to retreat from everybody because I wasn't comfortable in anybody else's, presence other than my own. But you kind of had this dual side to it, so that when you were forced into a situation where you had to be with people, you were almost overcompensating. You were almost, you were almost eccentric, and in the way that you were so cheerful, so chirpy. Right. But then at the first opportunity, you ran away and you hid on your own because you just didn't want to be around people. And it was this real high and low. And I think that's across all. When we had that group and we were speaking about it, and they were all so brave coming forward. It was in every single element of mental health. That was one thing which was all the way through. Was this feeling that you could only be comfortable in your own skin, hiding from people. And you couldn't face actually being around people, be it family or friends.
So, Sarah, what should we be looking out for? You know, if we're a bit worried about somebody, you know, in our family or a friend, what should we be looking out for then, the signs?
Where do we start? Because there are so many different mental illnesses. Nearly 1 in 4 people has a mental illness. And the sadness is that's why it's so fantastic to be here today, because we still don't talk about them. Now, the most common is depression. And there we're talking about what we as doctors look out for is 2 key symptoms. And what we say is, in the last week or in the last month, have you been bothered by either feeling down, depressed or hopeless, or by not enjoying things, by lack of enjoyment or pleasure in things? Now, I'm not saying that, you know, people should enjoy doing their tax return, but the sort of what we often find is that people just make excuses not to go out with their mates. So you might find, have they stood you up a few times, or have they been spending a lot more time in their room? Then we're looking at things like, are you having problems sleeping? Have you had somebody banging around in the early hours of the morning? Problems concentrating, seeming really tired, always too tired to do anything? Feeling guilty, maybe being in tears, being easily moved to tears, problems concentrating. Sometimes we find that people are either moving very slowly and people have noticed they seem to be slowed down, or speeded up. But then, of course, there are all the eating disorder things. So, for instance, with anorexia, the other big eating disorder apart from bulimia, you'll often find that people will start hiding themselves. And it's often, quite often, not always, quite often people have been really high achievers, people who've done brilliantly, the perfect daughter, the perfect son, the perfect sister. And suddenly they're obsessed with getting other people to eat. But funnily enough, when they sit down to eat, they've always just eaten, so they can't eat with you.
So that's really interesting.
Start wearing baggy clothes.
Yes. Yeah,
And they'll be cold a lot.
Yeah.
That's the other thing.
Right.
People think sort of. I mean, I remember in the height of summer, I'd be walking around with 4 or 5 jumpers and gloves and scarves on.
Because you'd be freezing.
Because you're so cold, you've got so little body fat, but also because your metabolism just slows right down because your body's trying to protect itself and keep the energy it can.
Important to remember, though, that most people with bulimia will be normal weight or sometimes overweight. They don't tend to be underweight. Adam was a bit of an exception because he was quite extreme in his vomiting.
For sure.
So it's not necessarily a warning sign, but with bulimia, you're looking out for signs of vomiting.
Because it's really, really hard for family to deal with this. Because first of all, you don't want to accept it maybe sometimes. But for you, I mean, family and friends must have helped you so much.
Yeah, they did. I mean, I think the hardest thing for my family was, because I've always been very independent from a very young age, it was they didn't know what to do because they didn't want to shatter the glass. That kind of mentality of, you know, would them helping actually make it worse?
Right.
So there was this horrible sort of eggy period for 18 months when I knew they knew that I knew that they knew, but nobody was quite sure what to do. Now, to me, the biggest help they ever gave me was just me knowing they were there. I think what you find with men particularly is men are really bad at sharing their, you know, feelings about anything.
Yeah,
which is why I think, you know, mental health can often, in men, it's now the biggest suicide, it's now the biggest killer of men under the age of 40, because we're not good at talking about problems. It's ridiculous, isn't it? And I'm not saying that, you know, women always talk about the big issues, but they talk about everything, you know, and the little things, so there's not that build-up. Whereas men, because they just bottle everything up. And to me, what the biggest relief was knowing that, although I didn't very often go and speak to them, was knowing that if I hit a brick wall, there was somebody I could talk to.
Right.
Even if I didn't talk to them, knowing that there was somebody there that I could talk to, that was, to me, the biggest support.
And would you say that's something that all parents or brothers, sisters, friends should do that?
I don't really need to be here because basically it's all about, you know, be there and be patient. Understand that, you know that if somebody's not eating or if they're throwing up, they're doing themselves harm. If they're self-harming, you know it's a really bad thing. You know that they hate themselves for doing it afterwards.
Yeah.
But understand that they can't help it. This is not because they want to be like that. And likewise, if they're depressed, there are going to be up and down days. The awful thing about an eating disorder is that you feel this urge to do it because you get this very brief release. And then suddenly you feel really awful for having done it. So you're up and down, your emotions are up and down all the time.
You know that, you live
and it's the added guilt. I mean, it's the same for alcoholics and for drug addicts. You know what you're doing is having an effect on other people. So not only do you think that you yourself are pathetic, but you also, you know, hate yourself for the fact that you're hurting those people who love you most. And it's this ever spiralling sort of decreasing circle.
But what's really, really good now is you have come through it and you're very happy now.
Yeah, I mean,
that's the thing. You've done so well.
I mean, the one thing I would say to everybody out there who has an issue at the moment is worried is, when you're in that place, you can't ever imagine a part of your life when it's not, you know, you might have slight better times, but you can never imagine it not being part of your life. True. And I can honestly say you do reach that point, and I'm lucky to have reached it, where it's, you know, I feel stronger, I feel more empathetic with other people. I actually feel I'm a better person for having gone through it when I did. And I did come out the other side, and people always have this slight look about is it something going to happen again? Hand on heart, I know I'm probably stronger than people who haven't had an issue in the past because I've seen those days.
Wish it on your worst enemy.
No, I wouldn't wish it on my worst enemy. But the fact that it did happen to me, and the fact that I was patient enough with myself and forgiving enough of myself to come through the other side, it actually made me a lot stronger for it.
Thank you for doing this for us. We really, really appreciate it. It's just great to see you so well and so happy. And thank you, Sarah. Thank you. Right, still to come between now and 9:25.